Hello. We'll discuss surgical innovation and intervention, physician and patient perspectives. I have no conflicts of interest to disclose. Medicine is not an exact science in the way that mathematics and physics are. It doesn't have many general principles that are valid most of the time. But every patient is different, and what is effective treatment for 90% of the population may not work for the other 10%. Thus, medicine is inherently experimental. Surgery and surgical techniques are not introduced into clinical practice as a result of rigorous research, such as randomized controlled trials and clinical trials, but through a gradual evolution of existing techniques that are invented and innovated through experience and experimentation by pioneering surgeons, or through audacious departures from the norm by a surgeon or a surgical team. Every day, surgeons modify existing operations in order to improve their techniques and outcomes. Provided it is consistent with accepted surgical principles and practices, a new variation on existing techniques may be considered non-experimental when it has a predictable, clinically beneficial result for the patient, and experimental when it may have an unpredictable or unknown benefit. While ethical principles of autonomy, beneficence, non-maleficence, and justice are no less considered in surgical innovation than in rigorously controlled clinical trials, the very nature of performing surgery itself leaves much room for individual and situational variation. There is no single standard approach to any surgical procedure, nor in the execution of alternative approaches. Surgeons maintain a balancing act on a tightrope between general surgical standards consistent with accepted surgical principles and practices, and specific surgeries, individual variations based on physician and patient factors. The latter highly depends on the ethical values of the physician: compassion, competence, and autonomy, as well as his or her individual experience, judgment, and skill. To the extent that patients perceive their surgeons as exercising these values and possessing these qualities, they may consent to surgical procedures whose outcomes, though not guaranteed, are expected to be beneficial more than harmful, where potential benefits outweigh possible risks. Let us reflect on two such cases. Christine is a 19-year-old orphan with stage 4 cancer of the larynx, her voice box, and cervical or neck lymph node metastasis. The recommended definite treatment entails complete removal of her voice box, called a total laryngectomy, and the cervical lymph nodes, or a neck dissection operation. Radiation therapy has already been maximized, but it failed. She is very young, but conservation, meaning less than complete removal of her voice box, while it may preserve functions such as speech, involves a greater risk of recurrence from microscopic cancer remnants. Options for total tumor removal with voice restoration by creating a tunnel or a fistula between her airway and food passages are largely experimental. Techniques have varying results and considerable risks of failure and/or complications, such as infection, aspiration of solids and liquids, especially in irradiated tissues. Alternatives such as esophageal speech or burping and an electrolarynx do not have these complications but produce lower quality speech. I recommend trying a new type of tracheoesophageal fistula that has never been performed before at the Philippine General Hospital and has not been performed in enough patients to determine its long-term success or failure. It has not been performed either in a previously irradiated neck, posing additional difficulties for surgery and risks of poor healing, but I'm willing to give it a try. What would you decide if you were Christine and her grandfather, and why or why not? Romuel is a 37-year-old office worker with stage 4 cancer of the tongue and the tongue base, which is the back part of the tongue. The recommended definitive treatment is complete or near complete removal of his tongue, which is called a total or near total glossectomy, through a mandibulotomy or splitting the lower jaw to access the tumor, followed by radiation therapy. He is relatively young and a professional voice user, and this surgery will result in severe loss of speech and swallowing functions, possibly necessitating a permanent tracheotomy or a hole in front of his neck. He is also engaged to be married. Conservation surgery, on the other hand, removal of the tumor only with a small cuff of tissue around it, may preserve enough tongue tissue for speech and swallowing, but it is risky and may be incomplete, resulting in residual unresected tumor. Transoral resection without splitting the mandible may further improve and hasten healing, decreasing surgical and hospitalization costs, but it further increases chances of incomplete resection and significantly increases the level of surgical difficulty. I recommend both conservation surgery and a transoral resection, admitting that other surgeons may not agree. Despite this, I believe the potential benefits outweigh the possible risks. What would you decide if you were Romuel or his fiancée, Jet? Why or why not? Share your individual answers to the reflection questions in class or in your small group. What ethical principles were considered in your hypothetical decisions? Christine underwent a total laryngectomy with a modified radical neck dissection and a primary tracheoesophageal fistula reconstruction in 1998. 18 years later, she is alive and well and able to speak intelligibly through the fistula by occluding the permanent stoma in front of her neck. She is happily married with 2 children and is cancer-free with no evidence of disease. Romuel underwent a transoral partial glossectomy, enucleating a tennis ball-sized tumor and surrounding cuff of tissue, and post-operative radiation in 2004. 12 years later, he is also alive and well, gainfully employed, and able to speak and swallow normally. He and Jet are happily married with 2 children. He is cancer-free with no evidence of disease. Now watch the interviews with Christine, Romuel, and Jet.
How are you? Good. Okay. Tell us about your finding out. There's something different This was with your lolo, right? Tell us about that.
Yung nalaman ko na may ganito ako, siguro mga 3 months akong paos. Hindi ko pinansin. Feeling ko cute ako. Tapos nung siguro mga 3 months, nagkalagnat ako ng 40 na hindi matanggal-tanggal. So doon ako nag-design pa-check up. So ang unang findings ay yung polyp. Sabi ng doktor sa Kalamba, pumunta ka sa PGH, mas ma-check up pa ng maayos. Tapos nung nag-PGH ako, unang labas pa lang ng pathologist mo ba yan? It's cancerous. Sa pagkakatanda ko, mga 4 times akong binayopsy just to make sure na cancerous siya. Kasi nung time na yon, ako yung pinakabata. Kasi usually daw yung mga gantong case ko ay mga chain smoker ang mga tinatamaan.
Were you smoking then?
Hindi naman. Kaya,
Hindi naman, sounds tentative.
mga occasional lang. Pero parang
Parang
bihirang
lang,
bihira.
hindi ganun heavy smoker.
Kaya siguro mga 3 to 4 times akong binayopsy. Talagang cancerous eh. Madaming procedure ang ginawa para masalba yung vocal cord ko. Pero pa rin, talagang cancer.
So, nung magdi-decision na kayo ni Lolo, what went on there? What were the things that made you decide?
Nung time na yun, parang no choice na. Parang, saan pa ba ako? Kasi nag-cobalt na ako nun eh. Nag-cobalt ako before ng operation, pero wala, useless siya. So parang wala nang ibang way, kundi operation. Pero parang doon ako umiyak. Pero nung sinabi ni Doc na lalagyan ka ng butas na para makapagsalita ka ulit, parang may pag-asa ulit. So parang saan pa ba ako? Doon ako syempre kahit risky yung operation, parang may pag-asa. Parang in-explain naman sa amin ni Doc Late na ganito yung mangyayari, ganyan. So, sige, pumayag kami ko anong decision ni Doc.
Because there was this other decision where ang nangyayari ay pwedeng may mikropono ka, etc. Iba ba ang procedure na yun? In-explain ba sa inyo?
Pero parang may idea na ako doon sa parang ano na yun eh. Parang
yung robot, yung sound.
parang isang tone, parang in-explain naman lahat. So parang doon na lang ako sa parang medyo normal. Parang paus lang kesa doon sa microphone na yan.
I see. Okay. So, parang sinabi mo, there is no choice, parang feeling mo no choice. And si Doc Joey explained it to you, and it was clear. And si Lolo rin, parang decision, let's go, let's do it. And
Tsaka nung time na po yun, kumalat na siya eh. Kumalat na siya dito sa ganito ko. So nung na-opera talagang asin, tapos din itong side na to eh. Kaya parang talagang wala na akong choice. As in, nag-start na siya mag-spread. Kaya, pero yung dun nga sinabi ni Doc na lalagyan natin niya ng butas para magkasalita ka ulit. Parang ting! Parang nandun na rin yung pag-asa. Kaysa nung unang sinabi niya na, yung una kasing sabi sa akin, mawawala ka ng boses. Tatanggalin yung vocal cord mo, yung larynx mo, parang doon pa na sa sinabi niya parang, ha? Pag tinanggal ang vocal cord mo, wala ka ng boses. Pipi ka na. Pero yung sinabi niya na, lalagyan natin yan ng butas para makapagsalita ka ulit ng parang normal, parang, wow, parang medyo nagkaroon ako ng hope. Parang doon na, sige go, kahit risky yan.
So, ngayon na, so how many years now?
18.
Na ganyan, 18 years. No? And did you get married? And
After 1 year ng operation. Kasi, yung asawa ko hindi na ako pinakawalan eh. Kasi sabi niya, kakaiba itong babaeng ito, hindi ako mabubulyawan. Hindi ako mabubulyawan. Eh, hindi niya alam, magkakaboses pa ako. Kaya, eto ka, ano ka ngayon, di ba? Kaya, yun, may dalawa na akong anak, mag-18, tsaka 12.
wonderful. So, when you look back doon sa decision mo, now that nakakasalita ka, nakakabulyaw ka na. So, what do you think?
Siyempre, proud.
Oo. Yes. Oo. Talaga.
Proud ako
Malakas na
dahil-
babae. Oo, di ba?
Strong proud ako. Tsaka pag hindi maiwasan sa ibang tao na pagka unang nakita ka, weird, babaeng to Pero pagka nalaman nila yung kwento mo, mas ano sila eh, parang humanga sila sa'yo. Nawala na yung question mark sa mukha nila eh. Parang more on, wow, galing mo naman. Parang mas na-inspired sila doon sa nangyari sa'yo. Nawala na yung question mark. Kaya yung mga taong ganun, kulang lang sila ng information eh. Kung ano yung nangyari sa'yo. Pero once na nakwento mo na kung ano yung nangyari sa'yo, kung ano yung napagdaanan mo na, magbabago na yung tingin nila.
Yes. So, Christine, I think I'd like to ask you to tell others na pag napunta sa situation na ganyan, ang isang tao, what should they do? I think you're the right person. You're an inspiring person, so maybe we can...
Ito based on my experience ay hindi yung sinabi lang ng iba. Sa akin kasi, jolly person kasi ako eh, parang hindi ko masyado pinaproblema yung problema. So, huwag masyadong dibdibin, parang the more mo dinidibdib, lalo kang, wala namang mangyayari eh, lalo ka lang ilulubog. Pangalawa, faith tsaka trust kay Lord. Kung ano yung katulad ko, anong time na-diagnose ako ng cancer, parang wala na ako sa tuwid na daan eh. Papalikong daan na ako para siguro binatukan ako ni Lord na konti. Parang after 18 years, nalaman ko yung purpose kung bakit ganun yung nangyari sa akin. Parang medyo binago ni Lord yung ano ko nang nawala man si larynx, si vocal cord. Eto ako, miss boses ako. Parang binalik niya lang din sa ibang way. Pero yun yung purpose niya eh. Siyempre, na ano ko yung asawa ko. Kasi hindi ko siya ma-appreciate kung bad girl ako dati na naging okay yung buhay ko sa asawa ko kasi yung family niya super bait, ang bait na asawa ko. Parang doon, naging okay yung buhay ko, parang natulungan ko yung mga pinsan ko, parang ganun yung may purpose God. Kung bakit ka binigyan ng ganyan, malalaman mo, hindi sa umpisa magka-question ka bakit. Pero pag tumagal, malalaman mo kung ano yung purpose mo. Tapos, siguro matutunan na lang baliwala yung ibang tao. Katulad ng sinabi ko na may mga taong mga nag-judge, mga judgmental. Titignan ko ano yung appearance mo. Pero, bigyan mo na sila ng information kung ano yung nangyari sa'yo. Babalik din na yan, wala na yan. Kaya yun lang, problemahin mo masyado.
Thank you, Christine. It's a pleasure speaking with you. Maraming salamat sa iyo.
Thank you po.
Well, tell us, how did you feel, or what were the things that you were feeling? That's why you decided that, parang there's something wrong here. What were the circumstances? Right away, nalaman mo ba? Ganon. So maybe I ask you first, Romel.
Yung timbang ko, bumaba, tapos lumalamig ko, hindi ko masyadong maluluwag na tapos po may singaw na inubo.
Okay.
Tapos yung ipid ko, akala ko din po nang galing, tumatama yung dila ko, yun sa ipid. Pagkatapos pumunta pa ako sa dentista para
So, ang sinabi mo lang, kay Jed, pupunta ako sa dentista.
Ako.
Jed, what happened there? Ano sinabi ng dentist?
Actually, I accompanied him to our company doctor. So sabi po ng doktor, sabi niya, siguro kaya nagsugat yung tongue because kailangan na bumagsak na yung ngipin. But because hypertensive ka, kailangan ng CT clearance. So, bumalik ka na lang dito, sabi, kapag may clearance ka na. So, we saw his internist sa ibang hospital po. Tapos, nung nakita ng doktor na sandali lang, Romel, sabi niya, mukhang iba ito. Kasi matigas, may bukol. So, after that, i-refer kita sa ibang specialist, sa ENT. Gumawa po ng referral yung doctor. Kaya lang what bothered us is, nung ginawa yung referral ko, talagang naka-staple talaga siya thoroughly na hindi mabasa ng patient. So, kinabahan siya. Yung pala, hindi ko alam yun. Sinilip niyo pala yung referral before we went to see another doctor.
And what was there in that referral?
Parang nabasa po kasi niya yung possible carcinoma.
What did you feel when you read it?
Parang lasang ako kasi hindi ko po alam yung gagawin. Tapos pinausap ko si
Jet ka?
Na girlfriend ko pa lang yung time na. Tapos hinintay namin ng doc. Tapos right po, sabi na ibabayos sila po. Pagkatapos ko ng biopsy, ilang linggo po bago lumabas ng resulta. Tapos nung nakita niya ng resulta, papilloma lang daw siya. Papilloma po.
Papilloma po.
Papilloma.
Benign na
Benign na bukol. Yun yung And then, after that, what about your decision making of what to do next? What happened there?
Kasi po yung sakit, lalong maging kalahati ng katawan ko yung sakit. Tapos yung bukol lumaki. Tapos yung sabi ko sa misis ko, baka may alam kang doktor. Yun pala ang kaklase niya, estudyante ni Dr. Peña. Niya-refer ko kami kay Dr. Peña.
Oh. So, ang decision nyo, after that was to go to Dr. Lapeña. And then Dr. Lapeña said, what did he say?
Nung una po, pagkakita pa lang na, iba na yung iba na po yung nakita ko sa mukha niya. Tapos may dusuro siya pinakita, picture. Ganito yung papilloma, ganito yung carcinoma. So, nangyayabot na po ako. Tapos talagang parang ang liit ng paningin ko. Wala na akong naririnig. Pinapitan ko agad ng misis ko, yung sigat po. Tapos,
were you there, Jed, nung
Yes.
sinabi yun ng doktor? Or what were you feeling there?
Nung sinabi po sa amin ni Doc Joey na ito yung papilloma. So, he handed to us parang, I don't know if it was a book or a brochure na sabi niya, ito yon kasi ito yung lumalabas doon sa biopsy result. Yung pong result kasi binigay niya namin sa kanila. So, sabi niya, itong sa'yo, kamukha ba nito? Sabi niya Romel, no, hindi po ganyan. Parang ganito yung lesions, yung sugat mo, di ba? Sabi ni doctor. He pointed to figure doon sa binigay niya. Sabi niya, opo. Tapos nung time na yun, nakatakip yung label. Tapos nung tinanggal ni Doc, nakita namin carcinoma. So, yun, parang nawala na siya sa sarili niya. Doc, ano pong gagawin ko? Parang ang iniisip niya, mababatay na ba ako? Ganon. Tapos sabi naman ni Doc, no, sabi niya gano'n. Ang treatment dyan, sabi na po siya kung anong possible na treatment. Sabi niya is, operation daw po. Kasi oral cancer. Tapos, in-explain niya kung ano yung mga possibilities. Tapos, we asked him, bakit lumabas sa biopsy na papilloma lang, na benign? Tapos, nung sabi naman niya, parang without saying anything, doon ako nabilib din po. Wala siyang sinabi against the other doctor na unang tumingin. Sabi niya, may mga constraints kasi yung biopsy. Sabi niya. So, posibleng yung sample na kinuha kay Romel, hindi nakita doon. Kasi syempre, dinanday yan. It undergoes a certain process, kanya. So, hindi na-diagnose siguro baka hindi nakita. Kanya. So, meron kayong option na mag-ulitin ulit yung biopsy. Ang sakit-sakit na nga ako, hindi siya makatulog, hindi siya makakain. Kung uulitin ba natin yung biopsy, or kahit na kung papilloma man yan or carcinoma, ang treatment kasi dyan is surgery, sabi ni Doc. So, gusto nyo ba na ipabiopsy ulit? Or gusto nyo na idiretso na natin sa operation, sabi niya. Tapos there's a way para malaman natin kung ano talaga yan, yung frozen section niya daw po. Yung mass na makukuha, dadalhin ka agad sa lab. Tapos doon po malalaman kung ano. Tapos, nag-usap po kami. And then, ang problem niya is how to tell his family, especially yung mother niya kasi parang nervyosa. Tapos, ayun, inisip namin na ano ba yung best solution. Inanong namin yung mga relatives namin. And we asked him, makakilala rin namin doctor. So, tapos tinanong din namin kung magkano yung magagastos sa operation. Kinompare po namin with PGH. So, talagang walang question. Sabi na, papa-opera na kaagad. Tapos, ang next na tinanong namin kay Dr. Yan, kasi wala po kaming pera. Magkano kaya yung magagastos? Sabi niya, ASAP yan. Actually, nagbiro pa nga si doctor. That's the difference kanya between a doctor and a lawyer. Ang doctor, because it's our call to save lives, sabi niya, gano'n. Tatanggapin namin yung pasyente kahit walang pambayad yan. Tapos saka na lang mag-usap kung ano man. Ang lawyer, kanya, kailangan bayaran mo muna acceptance fee bago niya i-take yung kaso mo. So, tapos nung sinabi po namin na kayo nang bahala doon, pero ako I'm ready anytime, sabi niya. Tapos nung sinabi namin na sige ASAP, saka na lang namin gagawa ng paraan kung paano kami magre-raise ng finances for the operation. Tumawag na kaagad si Doc sa PGH. Na-schedule na po kaagad yung operation. I think that was Wednesday when we saw him for yung consultation. And yung Sunday nun, na-admit na si Romuel. Tapos, the following day, first case po siya sa OR, na 6 a.m. yung operation. So, tinuloy na po. Tapos yun nga, after noong procedure, tapos lumabas na yung result noong sa frozen section. Yun nga po, ang findings is squamous cell carcinoma, well-differentiated, tapos parang stage 4. Oh my God. So, we were glad talaga na naagapan, na nagawan ka agad po ng treatment. Pero in-explain ni doctor, ano ba yung squamous cell carcinoma, ano bang ibig sabihin ng well-differentiated. And then the next na ano po niya is yun nga pong cobalt radiation therapy. So he underwent radiation therapy for 37 sessions, high dose radiation.
Roman, looking back, I heard you were saying you didn't know how to tell your mother who is tell me about that. So when you told her, was she, and then we'll go back again to your decision making and so on. So I'm interested also about your relatives, your mother in particular. Nung sinabi, ikaw nagsabi?
Kami dalawa po.
Oo, kasama si Jen. Of course.
Kasama ko talaga sa una pa kami.
How did you
sinabi ko
take
na
it?
lang po nung araw na yun na dadalhin ako sa hospital. Hinalo ko muna yung kondisyon niya. Kasi magaling po siya magsalita, hindi na po sa akin.
Magaling mag-explain.
Well, tsaka hindi na po ako nakakapagsalita na ayos kasi yung dila ako matigas na.
So, anong reaction ng mother niya? Well, there's no choice. Parang ganun.
Yes, yun nga po. Kaya lang ang sabi niya, naku, dahan-dahanin mo. Baka, kasi talagang pag ninilip ko si nanay, baka ma-hospital pa siya. So, nung sinabi ko nga po yung big possibility na cancer, talagang gumanon siya, ayokong marinig yan. Tapos pupunta siya sa restroom, ang tagal bago lumabas. Tapos sabi ko, kayong mag-alala kasi maoperahan naman kaagad. Papasok na namin sa hospital sa Sunday, ganyan. Pero hindi po dumalaw si nanay, hindi dumalaw yung mother. Takot na takot talaga siya. She was just praying sa bahay. Tapos inaayos niya lang kung ano yung kailangan.
And finally, with all these things in your mind, you finally decided. So you were convinced na feeling young, that's the best way, right, to do it. So, yung level ng yung confidence nyo kay Dr. Hui was there.
Yes, kasi po ang
Was that
una niya.
important? You think in decision making?
Yung una po niyang sinabi, ang mga doctors are being used by God as an instrument to heal people, save lives. So, sabi niya, kasi it's cancer, I'll do my best, of course. Sabi niya ganun. Kaya lang, hindi ko kayo binibigyan ng assurance na after ng surgery, okay na siya. So, tapos in-explain po ni doctor kung ano yung kung paano yung treatment, tapos yung conflict sa approaches, kasi nag-confer siya with yung mga iba pang mga
Tell me about that, kasi did you know that the other procedure was probably riskier than the other? Or you thought that ibigay niyo na sa doktor niyo yun? Or was that a choice na you were deciding on?
Yes, he made us choose po kung ano yung decision niya. Mag-aantay daw siya kung ano yung gagawin.
So, paano mo decide kung which one? Option A or option B?
Yung una kasi sa sobrang sakit niya, sabi ko, sige, Dok, tanggalin mo ng lahat. Hindi ako. Basta mabuhay lang ako. Buti naman pala, yung approach na binigay niya sa akin, hindi kung tinanggal pala ng lahat doon, na ako, wala din yung, hindi magiging normal yung buhay ko. Kasi yung approach niya, ngayon, naging normal naman po ako ngayon. Sabi na ako na iba, yung doc na nakakilala ko. Saan naghiwa? Nasaan naghiwa? Hinahanap niya, baka dito. Sabi ko, hindi din naman yung doc, dinukot niya.
Dinukot.
Hindi, may matitira dyan.
Bali kasi yung choices po, yung choice po na yung gustong mangyari dito, kung papayagan namin siya, kung papayag si Romel and the family is, approach niya, dudukutin yung tongue, tatanggalin, isi-save niya kung ano yung pwedeng ma-save para kahit papano makabalik, magkaroon ng semblance of normalcy after the operation. makapagsalita pa rin kasi may trauma pa rin na matitira. Kaya lang ang risk po, baka hindi makuha yung buong cancer mass. There's a possibility pag natira po, diba? So, may cancer pa rin siya. At risk pa rin yung life niya. The next option, sabi niya, actually, yung gusto pong mangyari ng ibang doctors, no? Yung mandibulotomy. Ang mandibulotomy daw po, i-open yung entire mandible, bubutasan siya dito, para po mabuksan. Tapos, madali lang po nilang ma-extract yung mass, tapos masisigurado daw nila na makukuha po lahat. However, ang kailangan daw po nun, ibabalik ulit sa dati using a titanium brace. May brace po na gagawin. Tapos yung screw niya, tapos sabi niya mas mahal din yun. Tinanong namin ano yung difference, kung magkano yung magagastos sa operation. Sabi niya, naku, siguro yung sa titanium screw kanya, mga ganito siguro yan. I don't exactly know, pero parang rough estimate lang. Plus, mas matagal ka dito sa hospital kasi hindi madaling magsara yan. Tapos mag-aantay pa tayo kanya na mag-heal ka before ka ma-discharge. After that, sabi niya ganun, kung titignan natin, baka mamaya kung magkaroon ng keloids, baka daw kailangan pa ng isang type, I'm not sure kung maxillofacial surgery yata po yun, para bumalik siya sa normal na itsura. Kaya lang sabi niya, kasi parang, Romel, meron ka pa kasing next treatment after the operation, yung cobalt, yung radiation therapy, para makasigurado tayo, sabi niya, na talagang wala na yung cancer mass. Tapos well-differentiated kasi yung type of cancer. Kaya sa lahat ng types ng cancer, yan yung pinakamatigas ang ulo. Yan yung kailangan high dose na radiation.
Gano'ng katagal yung decision making?
Nung po, yung decision making, hours lang po after, kasi na-admit po siya ng Sunday, no? Tapos yung oras na yon bago yung operation, nung in-explain na sa amin ni doctor yung pros and cons, noong dalawang approaches, ayun, nag-decide siya na, sige doc, subukan na lang natin yung sinasabi mo, I'm willing to take the risk kanya. Kasi iniisip po namin, madami kaming nakikita mga pasyente din sa PGH na ang lalaki ng mga hiwa, tapos parang talagang deformed yung mga face nila. Yes, it's true. Talagang nag-survive naman sila. Nakikita namin nakapila pa sila doon for radiation, ganyan. Kaya lang parang hindi na nga normal tignan. Tapos parang hirap sila, lumalayo yung mga tao. Sabi niya, siguro subukan natin na yung treatment muna na ano.
Alam na lang ninyo kung ano yung pros and cons, and I see that parang ang tagal nyo rin pinag-usapan at alam na lang ninyo yung options niyo. So looking back, at your experience and now that you are cancer-free, so how do you feel about the decisions and how they affected your life now? Paano na yung buhay mo ngayon na, di ba, cancer-free ka na?
Una kasi po, yung pangyayari nyo, dapat ikakasal na kami sana. Tapos, nagulo na yung arrangement. Kasi yung pera na. Pero, dahil na, yung approach na, yung pag-decide namin na yung approach ni Doc, naging successful po. Tapos, eto, normal, nagkapamilya pa, nagka-bonus, may dalawang anak, hindi po ako nagsisisi. At saka, 12 years na po ako na cancer. At nagpapasalamat ako hanggang ngayon. Kaya nga sabi ko kay Doc, anytime na gusto mo akong i-showroom or pakita sa ako po yung katibayan niya na dun sa approach na ginawa, pwede. pwede pa maging normal. Kasi nung una po kasi decision ko, tanggalin na lahat. Kung ginawa pala yun, nangyari, wala din.
Hindi ka makakapagsalita.
Wala akong pamilya.
So yung lessons learned doon, kayo mag-asawa na, meron kayong pamilya, etc. Siguro, Jen, meron ka rin dagdag doon sa sinabi niyo ba?
Sabi ko nga po, malaking blessing. Una-una friends, kasi we were referred to the right medical professional na nag-handle ng case niya very well. Kasi kung ibang doctor yan, actually pati yung after po noong operation, may mga follow-up check-ups po. Tapos may mga doctors din po na nasa clinic ni Dr. Joey. Tinitignan palagi si Romuel. Tapos naririnig namin na parang nung una may doubt sila, baka kung magsusurvive ba si Romuel, especially right after the operation. Feeling nila hindi siya tatagal. Baka may possibility na nandyan pa rin yung cancer, gano'n. Tapos, kung sila nga daw yun, parang naririnig namin na mas safe yung mandibulotomy, gano'n na lang. Siyempre, nung naging very interested po ako sa mga procedures So, nagtatanong ako doon sa mga friends ko na doctors. Tapos, nag-check ako sa internet. Nakita ko yung difference. And sabi ko ba, maswerte po kami kasi yung approach na ginawa ng doktor sa kanya made it possible na maging normal ulit siya after surviving the big C in cancer. So, tapos ano po yan parang continuous na check-up yan, follow-up check-up, tapos meron pang CT scan and everything. After the 5th year, na nag-survive siya dun sa operation and the cobalt treatment. Tapos sabi ni Doc, congratulations, Romuel, you are totally cancer-free. Sabi nga, nakalampas ka na ng 5 years. So, in-explain niya ulit na kung halimbawa man na kailangan maging ano ka pa rin, i-observe mo pa rin yung katawan mo, palaging kakapain mo. Ayaw niyo pala, sabi niya, kung duda ka, kanya nakikita niya kasi parang nag-worry. Kung duda ka, pwede kang magpa-CT scan, pwede pa natin. Kaya lang magkakagastos ka lang, sabi niya. Ikaw nararamdaman mo naman sa katawan mo if merong something na hindi normal. Kagaya nung dati pag kinakapa niyo po yung mga bukol, nodules. So, ganun lang ang gawin mo. Sabi parang basta kapag meron kang nakapa, may naramdaman ka na hindi tama, hindi normal. Patingin ka kaagad sa doctor, especially before we left po for La Union. Kasi dito kami sa Manila. Tapos na-assign kami together sa La Union. So doon na kami nag-raise ng family. Before namin, after ng operation. So sinasabi namin, before kami nagpunta doon sa place of assignment namin, we saw Doc Joey. Tapos yun, nagbilin siya sa amin na ganito. Sabi niya, ganito lang yung gagawin niyo palagi, ganyan. And then looking back, noong kasing nung nag-cobalt treatment na siya, ang dami niyang classmates sa cobalt room ng UPTGH. Talagang naaawa kami kasi it's true, na-survive nila yung cancer. Kaya lang pag nakita mo yung face nila, talagang mayroong mga deformities. Tapos yung iba po, kumbaga hindi na makalunok, kumakain, kumbaga dinadaan sa tube yung pagkain. That could have happened to him na hindi nangyari kasi salamat kasi gumaling siya. Sabi nga, parang we believe naman, we agree with his doctor na talagang if it's God's will, di ba, na madugtungan yung buhay niya, mangyayari at mangyayari.
So, last statements from you for others who discover that they have cancer, some recommendations.
Lakas ng loob ko. Tapos, maniwala na sa lalaki. Kasi nung time kong operahan ako, tumas ko yung BP. Tapos wala akong alam na paraan kasi nung oras na madala na ako sa operating. Wala po akong alam na gospel, so pumasok lang sa isipan ko lang, ama na. Kanta ka lang ako ng kanta. Tapos sana, yung imata. Kasi po, sinilas yung magbagaya ako sa jeep. Lumalayo yung tao. Lumalayo. Kaya ko nag-decide kami dun sa loob ng mga magpalakas. 5 years din po kami. Yun nga lang po, huwag lang katakutan yung cancer. Tsaka yung sa mga tao naman, katabi mo, lalayawan na. Kaya nakakahamay sa akin. Kahit yung mga kasamahan ko po sa kusina, kasi sunod na sunod ako. Tapos nangayaya. Nasabi pa ang adik daw.
Yes, kasi bumagsak po yung katawan niya, tapos sunod from here to yung area dito. So, kitang-kita po nakabarong siya. There was one time na magpapapalit siya ng cheque. Yung ID niya before yung operation and the radiation therapy at saka yung itsura niya magkaiba. So, hindi pinayagan ng bank na makapagpapalit siya yung mga cheque niya. I think those were your PhilHealth refund, ano? PhilHealth refund, hindi pinayagan ng isang bank po. Yung mga ganun, yung marami pa rin.
Then, police po ako ng ID. Kasi hindi ko nakamukha yung mga picture.
Plus, we had to present the medical records pa na, and then meron pang yung liaison officer pumanta pa na sinabi ko, siya ngayon, meron office beat ko. Marami pa rin mga tao siguro ang hindi talaga fully nakakaunawa sa cancer. Unang-una yung mga kasamahan niya sa cobalt room na noon, sabi parang feeling nila mamamatay na sila, ganyan. Parang kahit na nagpa-opera sila, parang they're skeptic na mabubuhay pa sila, ganyan. And then palagi lang namin sinasabi na ang cancer, ang key, di ba, para ma-survive siya, kailangan ma-detect ka agad. And you have to do something about it. Kasi yung iba po, di ba, kapag may mga nararamdaman ng mga bukol, kaya parang sinasabi nila na magpapa-albularyo, hanggang yun pala, biglang mga after a few months lang, mababalitaan mo, wala na. Yung pala, cancer yung mga naging sakit. So, we're happy na yung kahit pa paano na yung simpleng sakit lang ng ngipin, di ba, pave the way for yung early detection po ng kanyang condition. Kaya nagawan po ng treatment.
Yes. So, Romel and Jed, maraming salamat for sharing your story.
Thank you. It's our pleasure.
Let us consider another case, this time involving a young woman and her unborn child. Crisilda, a 25-year-old woman, was diagnosed to be carrying a fetus with a huge 11.2 by 10.5 by 9.8 centimeter anterior neck mass involving the cheek, chin, and neck from ear to chest, with a high probability of airway obstruction upon delivery. This is the actual image in the uterus. And if you take a look at it, what seems like that big ball in front of the head and the neck is the tumor. Here's a close-up. You can see the brain and eyes of the baby, and where the mouth and neck should be, there is this huge tumor. Here's a front view of that baby. You can see the eyes very clearly, and just below where the mouth and neck should be is a huge mass outlined faintly in blue. A year before this, a baby with a similar mass had died upon delivery when the airway could not be secured. A multidisciplinary team of perinatologists or OB/GYN specialists in high-risk maternal and fetal care, neonatologists or pediatricians subspecializing in newborn care, obstetric and pediatric anesthesiologists, diagnostic and interventional radiologists, operating room nurses, and a pediatric otolaryngologist head and neck surgeon met many times over just 1 month to plan an ex utero intrapartum treatment or exit procedure. I had previous experiences overseas in performing such a procedure, but it had never been successfully performed in the Philippines. It was previously attempted in another local institution, but the baby did not survive. The procedure would involve multiple risks to mother and child, requiring maximum uterine relaxation while maintaining optimum placental perfusion, as the fetus was only partially delivered to expose the head and the shoulders. Maintaining placental support this way could allow the airway to be established before completing delivery. In effect, the placenta would be a life support system for the partially delivered baby. But relaxing the uterus, while it would prevent premature contractions that could separate the placenta, also entailed lowering the mother's blood pressure and putting her at risk of extensive bleeding and death. On the other hand, the lowered blood pressure and uterine relaxation had to be balanced against the need for blood flow through the placenta to maintain the baby's circulation and prevent fetal hypoxia or death. What would you decide if you were Chris Hilda? Share your individual answers to the reflection questions in class or in your small group. What ethical principles were considered in your hypothetical decision? The whole operation lasted 110 minutes from induction of anesthesia. Both cyst aspiration to decompress the mass prior to the abdominal incision, as well as direct laryngeal intubation after delivery of the head, were attempted, but they failed. In the end, the contemplated backup strategy of a tracheostomy with simultaneous aspiration through the anterior neck mass established the baby's airway, while the baby remained connected to her mother through the placenta inside the uterus. Only after we had secured the airway was the umbilical cord cut and complete delivery of the baby performed. Immediate post-operative neonatal laryngoscopy, or looking into the larynx, showed a hypopharyngeal tumor extension with an edematous supraglottis and a deviated trachea or airway, confirming the team's preoperative diagnosis that the exit procedure had been truly life-saving. Watch the exit to airway slideshow featuring Chris Hilda and Chris Lynn. This was the first successful exit to airway procedure in the Philippines. Post-operative imaging further confirmed the extent of tumor that would have certainly prevented Chrislyn from taking her first breath of life. Both the mother, Griselda, and her baby, Chrislyn, are alive and well 10 months after. Chrislyn has undergone multiple sclerotherapy sessions in the operating room, decreasing the relative size of her tumor. She will soon undergo definitive surgical excision. We subsequently performed 2 more fetal surgeries, both on an emergency basis. The second exit procedure in December 2015 was also successful, but the baby died several months later from other problems, including sepsis. The third procedure was an emergency operation on placental support in August 2016. A surgical airway was successfully established, but the baby died an hour later from multiple other problems. Ethics is knowing the difference between what you have a right to do and what is right to do. At the end of the day, this above all, to thine own self be true, and it must follow as the night the day, thou canst not then be false to any man. Thank you.